One thing that's very clear that I learned from my early days startup experience is that having a niche focus is really helpful when you're trying to innovate. At an individual startup, an individual product level, that comes with doing one thing really well, creating an MVP that does that one thing really well, alpha and beta test it, right? So on and so forth.
Hey there, dental economist. If you're a dentist owner or a leader within a dental business thinking about growing production, case acceptance, patient and staff satisfaction, positive outcomes, and everything else that comes with running a dental business, then you're a dental economist, and you've come to the right place. Welcome to the Dental Economist Show. We're meeting at the intersection of profit and purpose as I sit down with dental leaders who share their stories about dentistry, business, and growth. Welcome back to the Dental Economist Show with me, Mike Huffaker. Today, we're excited to welcome Dr. Jeremy Krell, a pioneering general dentist and venture capitalist who has seamlessly blended the worlds of dentistry and business innovation. As the managing partner of Revere Partners, Jeremy has positioned himself at the forefront of the dental sector, focusing on oral health to propel forward-thinking technologies and solutions that promise to revolutionize dental care practices. Welcome to the show, Jeremy. How are you today?
Thanks, Mike. Thanks so much for having me. Really appreciate it. And being a guest here on the wonderful Dental Economist Show. Really doing well today and excited to have a talk about dental innovation, the technology, the investing opportunities. Really an exciting time to be in this space.
Yeah, it is a very exciting time. And I've been aware of you for quite some time and followed you on LinkedIn. So I'm really looking forward to having the conversation, get to know you a little bit better, and hearing a bit about some of the things that you've been working on. To start the conversation out, if you load up your LinkedIn profile and you scroll down all of the experiences, you've been involved in many different companies, organizations, from an advisor capacity, from an operating perspective. You've done dental chairside, so you've got this real broad breadth of experience. I would be really interested in hearing from your perspective what your career arc looks like and how you ended up, where you are today.
Yeah, absolutely. Happy to do that. And thank you so much for the kind words there. On the one hand, I come from a clinical dentistry background. I'm a general dentist. I've practiced chairside for a little under 10 years. Really enjoyed doing it, enjoyed treating patients, have done it in many states. Have done everything from adult cosmetics to family dentistry to even focusing for a couple of years there on just pediatric dentistry. So I've seen really the scope of clinical practice. And I felt that was important for my career because you have to understand how the entire system works in order to do anything within it, right? In order to innovate or invent, or impact anything within it. It really starts with that patient, provider, maybe you could say payer, triangle or relationship that's there. And so how better to understand it than to be in it. On the other hand, I come from a startup operator background. I actually started even before dentistry. I started with a web and graphic design company. Me and a friend spun two of them off and sold them. Thought that felt good. So went to a kind of luxury goods and commodity service targeting college students for 4 years from early days of founding to end stage acquisition. Also felt good. After that and some schooling, dental school, business school, so on, I went into healthcare technology. So from tech to health tech. In health tech, I had a leadership role at Oscar Health Insurance, heading up strategic provider innovations and development there, which means handling their hospital system partners and the technology integrations within. It was a really good opportunity to understand the healthcare system better, the payers, how the hospital systems, and just, broader healthcare delivery systems, how the technology works in it. From Oscar IPO'd, from Oscar went to Quip, subscription electric toothbrush, oral health product, professional services company, and led a role there, had a leadership role there, and helped build out the professional sales and marketing channel, did all the professional business development, clinical trials, all kinds of product feedback and improvement. So everything kind of from the professional side of the business. And it became a venture-backed unicorn quickly off the kind of subscription era that it came from. After that, so going from kind of tech to health tech to dental tech, I kind of went into this phase of dental investing and advising. I opened my own family office called the Barchester Bay Group and kind of kept running into this problem that dental technology companies disproportionately face a really hard time with fundraising. And so 4 to 5 years ago now, started Revere Partners as the first and only venture capital fund by dentists for dentists, dedicated to and focused on dental technology globally. And that's kind of takes us to today. So when I present it like that, I'll just point out the career arc sounds smooth, right? Tech to health tech to dental investing, and then doing it as an institution, but as any entrepreneur, should accurately tell you that there's plenty of headwinds, bumps, bruises, breaks. With that good, there's bad and ugly that's there. And it's how we learn. I've always been not just an abundance mindset of, in this case, having multiple opportunities to learn from, but also embracing the failure and the struggle as part of the success. And that is part of this career too, even though I try to condense it to a smooth looking curve per your question.
When I listen to that story and I hear about your early origins of your entrepreneurship, even prior to getting your DMD and becoming a dentist, and you build some of these businesses, you sell them off, you kind of get a taste for that. You clearly have this passion for technology as well. I understand that the value after the fact of having been in a chairside and practiced dentistry and really gotten kind of that holistic view of all of the ins and outs of the business from that approach as well. But it doesn't seem like it was necessary for you to do that to get to where you are. Was there some particular passion that you had for oral health? Was that always kind of a vision that you had that you were going to become a dentist at some point? Like, how did that come to be and how did that fit into that journey of yours?
Realistically, my interest ticked up over time. I think one thing that's very clear that I learned from my early days startup experience is that having a niche focus is really helpful when you're trying to innovate at an individual, startup and individual product level. That comes with doing one thing really well, creating an MVP that does that one thing really well, alpha and beta test it, right? So on and so forth. Right. You kind of in the startup version of that, you see it'll, play out in that way. Alternatively, in my field or in my, general focus, I put it there as I was going along, looking at different sectors to innovate in. So I came from a healthcare family. I was very already sort of knowledgeable and interested and passionate about healthcare. Nobody in my family comes from a dental background. So I think the next kind of peak came, I was maybe 12 or 13. It was time for me to get braces and really liked my own orthodontist and, not just the work he did clinically, but also the way in which he ran his business, his practice. So I kind of had another peak there. As I started to go through high school and then college and higher education, and I was in that pre-med track and also learning more internships and observation experiences and just learning more about what each of these professions do. That sort of combined ability to be a doctor that helps somebody that helps patients, an engineer, somebody that figures out the materials and the techniques to help that patient, and the artist, somebody who's able to bring creativity to the work that they do to solve problems. That sort of combined effect initially drew me to dentistry. And as I started to kind of uncover dentistry, I realized so many major trends that are going on. It was at the brink of really starting to consolidate as an industry, this dental support organization, DSO, trend. The technology was super antiquated, but new technologies were really starting to come and massively pick up, with some of the historical cases being the growth curve of implants and aligners and other major products that, we see today. So I think all those things combined led me to it. And I felt that I had to be a provider to really understand the space, be able to envision how that innovation would work in a real practice. Because it's one thing to create a great, innovate on a process and do it better, invent something new. And it's a whole other thing to implement it, right? Actually see it play out in a workflow and be successful. And both components are necessary to be a successful launch, right? To be a successful company. So I felt it was really important for that perspective. And the other reason is because I feel the professional is always a part of the equation. I think innovation that is sort of, skating the professional, is typically out of the scope of what I focus on. Typically the type of innovation, I'm most interested in and look at is, are ones that are always aligned with the dentist, aligned with the profession.
Let's dive into that a little bit more on the subject of innovations in oral health. So in your experience at Revere, how do you approach evaluating new innovations in this sector? What type of innovations catch your eye and kind of get you excited and maybe share some of the factors that you consider. So if somebody's considering coming and presenting to Revere Partners, what are some of the factors that you consider when you're determining if someone is a promising candidate for investment?
Look, I sit here after 4 to 5 years of very hard work, but we sit here very, fortunate and lucky and grateful that we see as many applications as we do. We see about 125 to 150 dental technology companies apply to us per quarter. We've seen over 1,100 to date, right? These are not sourced. We're not outbound. We're not pulling these in through, some sort of database or asking people to apply. These are the ones that organically apply to us for funding, right? So that I bring that up as, not a means to pat ourselves on the back, but a means to show how innovative this space is, right? And also, though, to talk a little bit more about the fact that it's extremely competitive. Just to the point of forming Revere, there's a real hindrance of capital flow into this space. There's so many opportunities. Again, there's a stratification of what any investor will find more interesting versus less, different types of investments, software, fintech, biotech, different stages of investments that are different, kind of risk levels, seed, series A, series B, and so on. So there's a lot that's in there, but it is a lot, right? It's pretty competitive. Things that catch our eyes or my eyes, I really like solutions that are kind of a breakthrough. They revamp or completely invent a new way of doing something, that is significantly better in terms of science and research, in terms of health outcomes, to the patient or, that the provider can help the patient get to. So, these areas of breakthrough technologies that I truly are groundbreaking, those can be some of the biggest wins. And especially getting involved at the right time, not necessarily when it's too early and not necessarily when it's too late. So I think breakthrough technologies is one. I like technologies where what I'll call the N or the number that are within the competitive set, even the indirect competitive set, those that are alternatives, is pretty low. If there's an N of 1 or an N of 2 or an N of 3, this is a lot better than, or a lot easier almost to get off the launch pad in many ways than it is when you're in a set that is super crowded and super saturated, right? It's much harder to, kind of stand out in terms of differentiation. It's a race to the bottom in terms of customer sets in those crowded spaces. It's unclear, to investors which is the horse to back, right? Who is better? Who's going to fail there? Who's going to, go on and last for a long time independently? Who's going to consolidate? Who's going to be acquired, right? It's much more difficult to kind of decide within those complicated channels. So when we see a channel where there's, something really great and the N is pretty low, that's exciting. Another thing I tell startups is we like to see progress. I think sometimes startups think of venture capitalists that we have this very rigid, algorithm in mind, and there are minimums. And if you don't hit the number or the minimum and, especially dollar numbers or growth percentages, then you're screened out. And I'm here to tell you it's a much more holistic screening process, at least for us. There's an application that we screen, primary diligence, secondary diligence, investment committees, all different types of info requested and analyzed throughout that process by a team of people who come from this industry. We have about 112 that outside of our core internal team of analysts and executives, we have lots of folks from different perspectives in this industry that help evaluate those. So it's a very holistic process. We like to see when startups keep us updated, being persistent without being annoying, and show us real momentum. I moved the needle by doing X in the last, month or quarter. We gained, we learned this, we gained this. We're still struggling here. And maybe there's sort of a sub point there in that those that do a really good job also tend to do a good job of embracing vulnerability, right? Where are the challenges? Where are they still struggling? And also are embracing learning, right? When they hear feedback, they're responding really well to that feedback, because at the base of all of these investments is people. You could have a great product or you're developing a great product. You don't even have one yet. At the end of the day, we have to believe in the people because the business part is tough. And I've got to have great people around that business, that we think are really going to be successful. And that's who we're empowering here at Revere.
Do you think that's a downfall for a lot of startup founders where they feel like they don't have the margin to be that transparent and honest related to the opportunity at hand? At some level, you have to pitch your company, your idea, your product with the notion that this is going to be successful. You have to have this kind of almost unshakable faith. But at the same time, the need to be realistic about the headwinds, the challenges that you're going to face in growing that company need to be shared as well. And I think that there can be maybe a belief that it is better to kind of minimize, those headwinds and paint a much rosier picture as, a VC when you're sitting and you're receiving that type of presentation. You kind of feel like you've got this BS meter dialed in at this point where, it's not really worth it to completely try to minimize those things. And it's actually more impactful when you have somebody that comes across as authentic and transparent.
Yeah, it's a big part of it, right? Because we're measuring people here and, do we want to work with these people going forward? No, you're right. There's a lot of kind of complex dynamics in sharing information. Revere handles this in a few different ways. We have isolated teams that evaluate each project as opposed to, kind of sharing people on similar projects. We have all of our team are under NDA with us, things of that nature. It's tough because the startups that, there's this balance between them wanting to share information, which they need to do to adequately pitch the opportunity and get somebody to understand enough to put their money in. And on the other hand, they sometimes feel like sharing too much could put them at risk of, somebody else ripping them off or stealing the idea. There's actually some interesting research on this from some of the business schools. UChicago Booth is one of them that goes to show that overall founders who share way more and founders who, shy away from sharing information tend to lose. This is particularly prevalent in sort of the traditional med tech mindset where you're dealing with more hard IP. And that's where a lot of this comes from, but you really do need to share in order to collaborate. You need to collaborate in order to build the brain trust of people around the thing to be successful. We also see it between, sort of a secondary gap in the industry. We see it between the startup and the potential partner, right? Not even the investor, but the channel sales, partner. For example, if they want to pair up with a manufacturer or distributor or, some sort of a DSO, some sort of strategic partner, we see interesting phenomenon go there. With the manufacturer and distributor, they'll share the least amount of information. They may not even take the conversation because they believe those people are actually capable of replicating their thing. Right. And a different phenomenon we see in the conversations with the sales prospects, these DSOs, right? An enterprise sale can be an exciting opportunity for them. And so what they jump on saying is, oh, we can do it. We have it. Got it. Right. There's this sort of chest bumping and, and pride that's there. But unfortunately, that tends to build distrust rather than being more accurate with the sales prospect. Because if that DSO happens to get into it and they find out you don't have something ready yet and you've got to develop it, all of a sudden they're frustrated and upset. They didn't get what they thought they were going to get. Of course, it's a tight-knit community, so word travels fast, right? That actually builds a lot more distrust. And then in general, when they go out for the next type of technology, they're tainted, right? They say, hey, we learned from that last one. We went out there, we did a contract with this thing, we put a bunch of resources on it. Turns out they didn't have any of this ready for us. And now I don't know if we can really, it's going to be hard for me to get a new technology in here. So there are these issues. And so to all the founders and founding teams out there, I would largely recommend embracing vulnerability, being as honest and transparent as you can be, telling us as much as you can reasonably and comfortably share about your product or thing, because it generally leads to better results overall.
And now you mentioned that you like to see progress with startups that you invest in, and you also kind of call it out. There's seed, pre-seed, series A, B, C. Is there a stage of investment that you really specialize in at Revere?
Yeah, Revere, we really look seed to series B, I think is fair. Not to say we can't invest out of that if we wanted to, but the average investment for us is a series A investment. We're looking to come in, where some of the market validation work, clinical validation work, product validation work is done. In most cases, the vast majority of cases, from our first portfolio, our fund one, which is 42 investments, most of those are in market. They are not only in market, but they are growing. They are not only growing, but they are revenue generating. They're not only revenue generating, but they're either, profitable now, or there's a pathway to profitability, meaning they're not profitable because they are putting money into growing, but a strategy to get to being profitable. These are the types of companies that we look at. But on the other hand, I'll always tell founders, it's not too early to start a conversation with an investor, at least not us. We leave an open door, right? We're more than happy to meet people. And, even pre-investment, if we are following them and they are keeping us updated on their progress, that can lead ultimately to an investment, right? Because now we've known this person for whatever it is, couple quarters, few quarters, a year or so. 2 years, right? We followed them. We know that they're going through the steps. They've kept us apprised of those steps. And, now we feel much more comfortable than somebody who's coming fresh into the diligence, who's just met this team and are being asked to come into a round with a pretty near term investment deadline. It's a lot harder for that, firm to get up to speed and up to speed quickly. Of course, we know how to do that too, but it's certainly nice to have the luxury of longevity, knowing them longer.
No, that's a great call out. I mean, that relationship can begin far before an investment actually takes place. And in fact, can lend itself to making that investment a smoother process when the timing is right. Because so much of this is clearly timing. When you talk about that you really love to see breakthrough technologies, you mentioned, and I'm going to forget the exact number, but 1,000 something, somewhere in the 1,100 range, different startups kind of being presented to Revere over the past year and a half, few years. What percentage of those would you kind of put in that bucket of a breakthrough technology? Like, just how rare is it where you see something and you say, you know what, this is a category creator. This is something that has not existed before. You really are in a unique place. You're not in an N of 10 or however many where there's ultimately going to be a winner and we're not sure which horse to bet on at this point. Is that something that is relatively uncommon? Or is there just that much innovation taking place in dental right now where you see it more frequently than one might think?
I'd say it's pretty, rare. I'd say it's less than 2 to 3% of what's out there is really breakthrough. Again, that's not the only criteria, of course, that we have to invest. There are some companies that we, of course, invest in, areas that are seeing more traction. Certainly, I would say it's less than 2 to 3% that we see or that's in dental tech. One example would be a company called Perceptive. They're Boston-based. You may have seen in mainstream media. They did this first in-human AI-driven autonomous dental procedure. They have a very unique imaging modality. It's structured light, non-ionizing radiation, works just like an intraoral scanner in your mouth, but can see in the tooth, which is pretty unique. And then a robot that can prep crowns on the tooth in under 10 minutes down to a level of sensitivity, specificity, accuracy that's, within microns. So really interesting, right? Both the imaging modality, which they kind of developed by accident because it's necessary for the rest of their workflow, but on its own is a game changer because otherwise you just have x-rays or 3D radiology, or you have an intraoral scanner just mapping the outside of the tooth, but you don't have anything in the middle there. That's one, game changer. And then the robot is ahead of its time. Robotics is certainly ahead of its time right now, but this thing works. It works well. It can make a practice more efficient. I'll bust the myth right away that if anybody's thinking, wow, this might take our jobs as dentists, you're thinking about this the wrong way. This is what we heard about implants and aligners and AI on radiographs and so on. So it's not taking anybody's job. It's always driven by the human, and it's there to make you more efficient. If it helps, think about the medical field to have had the Da Vinci robot for a long time.
Absolutely. Yeah, I just had a conversation with Dr. Zarabi on the podcast a couple episodes ago, and we got into talking about the robotics and that as well. And he had the same viewpoint because, it's the wrong approach to believe that this should be threatening. It's something that should be embraced because it can just improve the overall patient care that we can deliver in our practices. And there's still always going to be the need for the dentist. I think that's a great call out. As you're thinking about these really innovative, disruptive technologies, what else are you seeing out there? What's getting you excited that you're just like, this is really cool stuff that is going to really make a difference here in the not too distant future?
So many opportunities. Now that Revere has closed its first fund and we're on fund 3 now. So we have a new fund open and we're actively raising that. We're seeing even more opportunities come in. So some of the other areas, and often they point to real pain points within the industry. So a couple of those examples, staffing, such a massive problem, especially around the hygienist, the assistant, and having them there to empower the rest of the team and the practice. So, I've really seen some innovative and high growing models in that space. Things like cloud dentistry, Toothio, really matching the right person to the practice and working within the practice or the DSO's model. Another major area, revenue cycle management, huge pain point, being able to quickly get eligibility and insurance, verification from a number of payers, a number of policies. It's a very tough thing, but it's low hanging fruit. It makes a big difference in what your headcount is actually spending all these hours, kind of doing. You still need, again, You still need the people, the same people there roughly to help you still put attention on the patient. But instead, the point is their attention's on the patient and not on waiting on hold with an insurance company where we don't need their attention. So, looking at companies like AirPay or Zoob in that space, big areas of growth like oral systemic health links, right? It's pretty well established now in science and research, the number of conditions that can be, seen or monitored in the mouth, this essence of microbiome and the bacteria and their, signaling pathways and their toxic byproducts that have impacts all over the body. So that's another area. We've invested in a company, Lura Health, which is, continuous monitoring. We've looked at and invested in a company called Bristle in Biome. These companies are measuring the bacteria, what they're doing in your mouth, educating the patient, giving them real modalities to handle that.
Is that the saliva testing that you do as a patient when you go in?
Bristle and Viome do saliva testing, and Viome also does blood and stool. Viome covers gut health. Viome also covers oral cancer screening. Bristle Health's a little bit more focused on, what is the spectrum of bacteria, broadly in your mouth? What are they doing, especially the bad actors? How can you get educated and act on that? So these are all, areas that I think, we're starting to see dental practices, dental patients in general, pick up as highly important.
Talk about the staffing piece real quick. When you have a company, how dentistry is one of the ones that you mentioned, and I know that this has become something that a lot of groups are looking for, and it's absolutely a problem to be solved. Is part of the challenge that people just don't want to be working full time. So you have more part-time workforce available that are readily there to be brought into a practice on a temp basis. But those same individuals would just prefer not to be hired on full time. Like, how does the blend work where the workforce is available via, the app and via these temporary applications versus to hire as a full-time employee?
Look, it's really a tough problem. And there's so many factors at play here, post-COVID especially, and this era of working fractionally and working virtually, working from home, alternative career paths. There was a real, sort of rebirth. None of those are necessarily new concepts, but there was a rebirth of them and a readoption of them. And I think not that this trend didn't exist, before that, but I think it's a significant problem, after that. I think it's a real lifestyle change, that society is facing. Do I have to work this much in person? And this is hard work. Dentists and dental assistants, they're the lifeblood of the practice. They're working really hard all day long. It's a rigorous day. It's taxing mentally and physically. Do I have to do that to have the lifestyle that I want? That is a question that comes home to the dinner table every single day for, I think, all of our great Americans. And so that's one thing. There are kind of major macro trends that are there that you really have to think about. There's a whole area of legal complexity here, which is, how is the best way to hire, full-time talent, these, firms that are essentially hiring them for you, paying them W-2, paying them 1099. And I'm neither a lawyer nor an accountant, but for different needs and even in different states, there's different solutions, right? So that's another, complexity. I think from, the cloud dentistry standpoint, because you brought it up specifically, and especially hygienists, I really like how their algorithm works. It's really kind of a matching system. If you married a dating app and a staffing platform kind of together, you would get that, right? They take real sort of precision to matching the right person to the right practice, which I think is interesting. I also hear I hear something interesting, especially from the startups, but even, validated by the practices. The biggest competition out there, even above people not wanting to be in the workforce as much for these staffing platforms, is Indeed. It's actually these large, and that's the reason they're nationwide, staffing platforms. And so people are listing roles and using things like Indeed or Monster.com or ZipRecruiter, or sometimes I guess even LinkedIn, I've heard, or if you Facebook, some of the other social media platforms. The issue is it's a lot harder to get a match. It's a lot harder to get quality. It's a lot harder to control the business model that is, going to work for the practice that way. So, that's another challenge that comes from this, right? They're going to 18 sources. Some of them are very large and non-dental specific, all the way down to local, varied, sometimes hyper local resources, in order to kind of find people and then, retaining them is really difficult, right? I think practices should think about, really screening to find a person that fits and then really being willing to accommodate them. If they want a little more, it might be worth it to pay them a little more because you keep them. And you really want to make sure that they jive well with the other people in your practice so that they don't leave. And you want to carefully manage their schedule so that they don't burn out. And I know that's challenging for a practice because having to slot in different people in different places, having to manage P&Ls, that's kind of the other side of the equation. And those have to work out too. It's a very challenging space and it's a challenging time in general for staffing, and dentistry is not alone, and nor is healthcare. But I think it really comes down to getting that match. And that's why I think some of these, models that are catering to the dental practice or catering to the DSO, catering to a specific position and helping them find that match is also helping to get rid of some of the noise that's out there in this complex decision.
Yeah, I think the specialization piece is so important, especially in dentistry. And I love the matching concept where, you can get a better sense of whether or not this individual is going to be a good fit just through the algorithm within the application prior to even having to, look to bring this person on and to bring them into your practice. So it's a great concept. I had also not heard Monster brought up in many years. And so I almost forgot that still existed. It was all the rage when I was in college far too long ago. You mentioned a couple other companies as well there, Zoob and AirPay. And we just had Derek and AirPay present to us at our sales meeting a week ago. They're doing some really awesome, innovative things. And I agree that problem just needs to be solved. And it's really exciting to have some of this best-in-class software that is out there in the market that is just specifically solving some of the hardest problems and not looking to be all things for all people, because you're just getting this higher level of quality, higher level of output. And I just really have a lot of respect for what both of those organizations are doing. I'm going to switch topics here as we go close. I want to be conscious of your time. We were speaking earlier, and you're the chairman of the board of advisors of the High Point University Workman School of Dental Medicine in North Carolina. I know this is a new dental school for the university, and you had mentioned that the focus is different and there's kind of a unique approach. Can you talk a little bit more about that?
Yeah, I really love my role there. I'm grateful for that because I think it culminates a lot of what I've learned so far from my career, what I've become interested in my career, but in an educational setting. So yeah, High Point University's Workman School of Dental Medicine is a new dental school. It's fully accredited. It's accepted its first class. Their first class is currently in session. High Point is an amazing university on its own. It's led by a president that is extremely forward thinking, has taken such extreme attention to detail there. The school's motto is sort of around practical skills development. So really takes a very pragmatic approach to education. So I think it's the right place for the school's approach to be set. On the academic side, it has this CARE curriculum, right? So it has to meet the same learning objectives of any other accredited, school, but it is structured in a little bit of a different way where, CARE is going to break down into different areas. Like the C is for, clinical. And, you have other elements in there, where the A is for advocacy, the R is for research, the E is for entrepreneur. These key components of what they believe to be, a clinician in today's world. Clinical part of the education is actually being done in a real practice setting, right? So think, sort of an academically run, owned and operated DSO. So, they'll ultimately have about 30 practices or so organized into 3 hubs in High Point, North Carolina, around Greensboro, Winston-Salem, these areas. And within them, a collection of practices that are specialty, that are FQHC, that are general dentistry, that are, the hub itself is a bigger learning center. And the student kind of rotates around to the different practices, rotates to the different positions within each practice, tries a large multitude of different advanced technology, gets educated in the clinical setting, right? It's this sort of sense of an oral health network, a distributed oral health network where the students learn. What they're really doing there is, selecting for, educating, and training dentists to be not only workforce ready, but workforce advanced.
The CARE acronym there, it sounds like the approach is to be very well-rounded and not just focus on just one element of dentistry. And then the explanation that you just provided about how they will work in these real-world scenarios and have exposure to kind of different environments it sounds very unique and also very beneficial to the students that go through a curriculum and a course like that to have that higher level of preparation when entering into the real world. Class just started. So this is a new dental school. Do you have an idea of what class size can look like or what it will look like in the future? And also, where would people go if you're looking to go to dental school and you want to learn more about this? Where can they go and find more information?
So best place to find information is on the HPU Workman School of Dental Medicine website. You can just quickly, Google HPU WSDM or HPU Dental School. It'll come right up. And in terms of the class size, I think their initial class size is about 60, 65 or so, which I would say is on the smaller end. And then they were very selective. They had actually an enormous amount of students that applied. And then I think they're going to grow it, to probably somewhere around 90, 100 or so, which would be pretty average, pretty on par for dental school class sizes. And I can't emphasize enough two things. First of all, the supporters that have made this possible. Sitting on that board with me include Rick Workman and Steve Thorne from Pacific Dental. It's very hard to get better advice on how to structure an organization in clinical care delivery and dentistry than the two of them. And especially all the advice of, Rick from growing the largest DSO to Steve, who's, taken in a combined oral medical approach to technology companies that are on there, from Invista to Align, really large, manufacturers, all the way down to much smaller focused ones, Overjet. There are so many collaborators that are a part of this thing. It's incredible to watch. And then in those practices, and of course, because, I'm largely a technology nerd in dentistry, to see the technology play out. I mean, they have a state-of-the-art facility that's a haptics lab. They have the most advanced haptics machinery and the most number of them, I think, in any one place. And that haptics lab is incredible. This is nothing like how I prepared for dental school when I was in dental school. These machines, you're holding something in your hand that really looks and feels like you're doing a procedure on a real tooth or in a real mouth. It is measuring you, your pressure, your angulation so accurately, providing real-time feedback. I mean, the learning modalities that are available there are really impressive to see. And of course, our hope is that, the clinicians that graduate will really do special things here in the dental industry.
That's really great to hear. And when you hear things like that, you can't help but feel that there's a bright future for dentistry and that, we're on the right path here and that there's going to be just a lot of amazing things to come. I think when you're in the day-to-day, it's easy to just kind of look at the challenges and the headwinds and other things that the industry is facing. And you hear about these, new initiatives and new schools and new approaches and realize that, innovation is really the unlock to the future potential of what we have here. The last question before we wrap, you talked about, being vulnerable. You talked about transparency. You talked about your love for innovation and technology. And, you seem to be someone that is in a continual state of looking to learn and kind of understand new things. And so what is your approach to your continual education, if you will, just out in the world? Where do you go to learn new things? Or any podcasts you listen to, books you read, just kind of anything in general that you're really attracted towards?
I'll say it starts right here at home is the first place. I'll tell you, I am from a family of boys. I have all brothers. And I'll also tell you, I'm in quite a different situation in my current home where my wife and my 3 daughters and the female dog put me at a 5-to-1 ratio. So I'll tell you, I'm on a very steep learning. My kids are young, but I'm on a very steep learning curve here at home, learning new things every day, having to totally adjust my presets about, how kids at this age work. And I know that's going to continue through later years of age and schooling to my parenting style. So I'm doing this rebuilding, this remodeling every day at home. And that's sort of helpful as a motor to inspire and also be doing that at work. And I think it's also very true and representative of the Revere family across our, we have dozens on our internal management team. As I mentioned, we have hundreds, on our broader team. If you include the investors and, everybody within the ecosystem, more hundreds. If you're talking about all the practices we have direct access to, you're talking about tens of thousands. So I'm learning from all of them every day. I feel like the luckiest guy because I get to sit in a position at Revere where I'm hearing all different perspectives from really smart people, right? People who are so much smarter than me and who know areas of dentistry so much better than me, whether it's a type of business or a type of technology. These are really smart folks that are around us. And it's what helps us to make the right investment decisions. And it's also, I think, what attracts the investors to this space, from dentists and doctors to angels and high net worth individuals, family offices, funds, corporates. We have so many types of investors in Revere. And I think above all else, what is attracting them is, the real level of industry ingrained and aligned people on this, right? It's, again, we're the only one that is founded by and for dentists, always involving and heavily ingraining dentists in this, as well as, having the VC background and experience directly on our team, as well as having the technology expertise on our team, right? We don't just know sort of one area of dentistry or dental industry. We really stick to those pillars. And I think that helps me to continue to learn, right? Every day we tell ourselves kind of learn one new thing. It's like I'm learning a dozen new things a day. It's maybe more. It's a very high rate of learning for me. And I really have the team and the Revere ecosystem to thank for that.
That's fantastic. I really enjoyed the conversation. This was a lot of fun. For people that want to find yourself or want to find Revere partners, where should they go? How can they find you?
Always accessible, and we always keep an open door. Can visit our website, reverepartnersvc.com. Welcome to email me, jeremy@reverepartnersvc.com, or always can reach me also on LinkedIn. Always happy to connect with different folks who might be interested in investing in dental technology in our funds, interested in connecting with founders, and also interested in connecting with collaborators or folks that we can, partner with and meet new people in dentistry. That's the fun of it.
Thank you so much for joining. I really appreciate it.
Thanks, Mike.
The Dental Economist Show is brought to you by Planet DDS, home of Dental OS. To find out more about how cloud-based dental software by Planet DDS helps unleash dentists and their staff to focus on patient care, visit www.planetdds.com. Stay tuned for upcoming episodes by following wherever you listen to podcasts. And thank you for listening.